Let's start with the basics. What are STIs? Sexually transmitted infections, or STIs, are a group of infections that are primarily spread through sexual activity. This includes vaginal, anal, and oral sex, but it's important to know that some STIs can also be passed through close skin-to-skin contact, even if there's no penetration. STIs are infections passed through sexual contact, including vaginal, anal, and oral sex. They can affect anyone, regardless of age, gender, or sexual orientation. Even activities like kissing or sharing sex toys can sometimes transmit certain infections. These infections are caused by different types of germs: bacteria, viruses, or parasites. They spread through bodily fluids like semen, vaginal fluids, blood, and sometimes even saliva. Some STIs, like herpes and HPV, can be passed just by skin-to-skin contact without any exchange of fluids. It's a common misconception that you can always tell if someone has an STI, but many people don't show any symptoms at all. That's why it's possible to have an STI and not even know it, which makes regular testing so important. Anyone who is sexually active can get an STI. There's absolutely no shame in it. STIs are incredibly common, and getting one doesn't mean you've done anything wrong. What matters most is how you take care of your health and the health of your partners. The term STI is used because you can have an infection without symptoms. In fact, many people feel completely healthy and still carry an infection that could be passed to others. That's why regular testing is so important, even if you feel fine. Testing is quick, confidential, and can help catch infections early, before they cause complications or are passed on to others. Oral sex can also transmit STIs, since the mouth and throat have mucous membranes that allow bacteria and viruses to enter the body. It's important to remember that protection, like condoms and dental dams, can help reduce the risk during all types of sexual activity. The good news is that most STIs are treatable, and many are curable with medication. Early treatment can prevent long-term health problems and help you feel better faster. Bacterial STIs like chlamydia, gonorrhea, and syphilis can be cured with antibiotics. Viral STIs such as herpes and HIV can't be cured, but they can be managed with medication so you can live a healthy life. Early diagnosis is key. Knowing the signs, including those that might appear in your mouth or throat, helps protect your long-term health and the health of your partners. Don't wait for symptoms to appear. Make regular testing a normal part of your health routine, especially if you have new or multiple partners. It's a simple step that keeps you and your partners safe. Understanding how STIs spread, how to protect yourself, and when to get tested is your first line of defense. Taking charge of your sexual health is empowering, and it's something everyone deserves.